recipients come in saying, I'm going to be having a procedure in the morning. I want BioTouch
Right.
because they know
Right.
that the it helps the body prepare, for the anxiety and just opens the body up and prepares it in this loving way to whatever needs to happen.
So this whole idea this came up because I'm getting ready to go with Jenny for an operation tomorrow. BioTouch can be used with all these things and not having to worry about any kind of harm to the person going in for the operation. And I think that's the key issue here because they give you a whole list of things pre-op. You can't do
Right.
this and you can't do that and stop taking any supplements and don't do this and that. But BioTouch is not going to give you any harm. Even with homeopathy, it's you have to figure out the different protocols and
Yeah.
then you have to go buy them. And for some people that can be confusing. But with BioTouch, like you said, people can't had already come into the center for pre-op just to help the body get ready, like you said.
That just really empowers our, what we're always saying, just touch, because there is none of that concern, as you were just saying, about what not to do and the little protocols that the doctors give you, can't drink this, you can't eat this, within some, you can't do that. When you have BioTouch, there's none of that. You just touch.
Right.
I mean, we really mean that, just touch.
Just touch. And I think what's great about having the opportunity to do BioTouch is it's good for both the person who's getting the operation and the person who's totally anxious that their loved one's going in for an operation.
The
It's
one that sits in the waiting room,
right,
right?
right.
Yeah.
And so you're immediately, even before you get to the hospital or to the operating room, are able to do something with your loved one, and you're both being able to calm down and relax and making a communication at a level that goes beyond all the anxiety and the fear, and it just sort of takes it down a few notches.
You know what I was just thinking, because I've heard, and I know most of all of us have heard about certain doctors and hospitals who are now offering little meditation sessions before surgery, to just because they know that it just helps calm the body down. Can you imagine if the protocol in the hospitals would be a BioTouch session?
Right, right.
I mean, that's meditation.
Yes,
Hello,
it's
and the body.
one of the best meditations I've ever seen because it's not about stopping something. Oh, you got to stop your mind or you got to breathe. I mean,
Right.
if you're anxious, it's very hard to meditate, because your mind's just worried about, oh my God, what's going to happen? Am I going to deal with the anesthesia? What's going to happen afterwards? This whole unknown quality. And then you're in these places that have lights blaring around and they're
Yeah.
cold and they're sterile. And so to sit and
All of
just
the
sort of be
above.
mindful and meditate, so called, is very difficult. But with BioTouch, the meditation is you're just present with who you are. And just by doing those points, I don't have to stop the mind. It sort of automatically happens if I'm just doing the points. And all of that other stuff just sort of dissipates, is a good word. It just sort of dissipates because
It,
I'm
it,
just focusing on doing a few points.
well, and the other thing is, when you do this prior to an invasive procedure, you've just been connected with another human being that says, with that touch, I care, I'm here, I love you, and everything's okay.
Right. And
You
that's
know?
so
I
vital.
mean,
It doesn't
yeah,
matter. It could be just a simple extraction of a tooth,
exactly.
all the
Exactly.
way to open heart surgery, or like Jenny's going to have an eye operation.
Yeah.
I mean, no matter how much you say it's going to be okay, it's going to be okay, giving your life up to somebody else
Yeah.
is not very
You're
easy for us.
vulnerable.
Yeah, totally vulnerable. That's a
Yeah.
good word. So
Right.
BioTouch helps with the vulnerability. So the
Mm.
pre-op is vital, and that can be done, weeks before, but especially the day of, the morning of, the night before.